Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. The end of 2021, much like the end of 2020, is again going to be dominated by COVID-19. Unfortunately, there's the emergence of the Omicron variant, new daily infections setting record highs day after day in Korea, and the number of seriously ill patients is putting an enormous strain on the country's healthcare system. There's emerging evidence, although not yet proven, that shows the strain is more transmissible, that's what the WHO is now saying, than any other variant that has come before it.
And scientists are in a race against time to find answers to all the questions swirling about Omicron and how severe its impact could be on the healthcare systems and the vaccinations we currently have. For more on this, we are joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor.
Good morning.
Now, Professor, the preliminary data shows Omicron is doubling in cases worldwide every 2 to 2.5 days, and some experts say it will overtake the Delta as the dominant strain within weeks. First, do you agree with this? And if so, what time frame are we looking at?
Certainly, it's spreading very fast, and the time it's going to take to go above Delta will depend on the country. In the United Kingdom, I know they recently said they expect Omicron to be the dominant strain within 2 to 3 weeks. But in other places, maybe in Korea, if you haven't got so much Omicron yet, it's going to take longer for that to happen. But most likely, there's more Omicron than you realize in Korea, and most likely it will be spreading faster than Delta, meaning that within maybe 1 to 2 months at most, it will become the most dominant strain in Korea as well.
Yeah, my second question touches upon what you just mentioned there, because as we've seen thus far, South Korea has only really confirmed a few dozen Omicron cases. However, since not much is known about what the symptoms are of this new strain, there is some concern among people that the actual number could be a lot higher than we know right now, and people are out there wandering around, going to gatherings and spreading it around, and South Korea, like other countries, could be sitting on a ticking time bomb right now.
Well, there are ways to determine whether COVID infections are Omicron or not. The best way is with virus sequencing, and I'm sure you're doing a lot of virus sequencing in Korea, so you will see that if it shows up. Another way is with some of the PCR assays. There's a particular fingerprint of Omicron just in the PCR assay, and that's being used in some places to keep track of things. So I think in Korea, you will find out more information very soon about how much Omicron there really is. I'm sure that it's more than just a handful of cases, but as yet, most likely Delta is still the predominant strain. It's very worrying when I see your rising cases to higher and higher levels each day.
And also, Professor Cowling, South Korea has seen COVID-19 cases skyrocket in recent weeks. Until now, you could argue South Korea has seen a relatively small number of cases, but it was only yesterday that figures topped 7,000 cases in a day for the first time. Now, based on what we've seen in other countries, should Korea expect the situation to get far worse in the coming weeks?
Yeah, one of the things we've got to remember with COVID from the last 18 months is that even if the government acts very strictly now, today, there will still be increases in cases for another 2 weeks before we see the impact of the measures that are implemented today, because there's so many people already infected but don't yet know it. They're going to develop symptoms, and some minority of those might need to go to hospital. So you've got to act soon. And don't expect an immediate reaction in the epidemic curve. Numbers are still going to be going up. So for sure, there's going to be more cases. There are going to be record numbers of cases next week in Korea, and even the week after that, even if action's taken today to try and slow things down substantially.
Yeah, even officials here are warning that we could be into 5-figure cases before too long. Finally, it's just human nature when there isn't much information flying around, but rumours start to spread like wildfire, particularly on the internet. But the latest speculation here in South Korea is that Omicron can be transmitted through the air, and this is spooking a lot of people out naturally. You're in Hong Kong, and I was reading there was a report out of Hong Kong that said Omicron actually infected 2 fully vaccinated people. They didn't come into contact with each other. In fact, they were staying in different hotel rooms. Now, it's purely speculation at this point. But if it were to be the case that this strain is capable of airborne transmission. How worrying should that be?
Well, I don't think that this is news, actually, with COVID. I think we've known for quite a while that it can spread through the air. And I remember very distinctly the Japanese recommendations with the 3 Cs early in the pandemic: avoid close contact, crowded situations, and confined spaces. And those are the hallmarks of airborne transmission. In Korea, you had that big early outbreak in March 2020 with the religious community. I suspect airborne transmission was involved at that point. And so I don't think Omicron has a different mode of spread, but it's more contagious. So we would expect more super spreading events, more rapid transmission. And we've really got to be very, very careful with the Omicron variant specifically.
Yes, all the more we should be more prepared and be careful to not get transmitted. Now, Professor Cowling, as always, a pleasure to hear your insights, and thank you so much for joining us again.
Thank you.